According to the latest statistics, nearly 90% of American adults have cell phones. Really, that low? 90? I thought it'd be even more than that. Well, now those adults, nearly a third of them, they describe their phones as something that they absolutely cannot live without. But do cell phones cause a secret health risk? Dr. Scot Ackerman, one of the First Coast's leading oncologists, is joining us today to talk about important health issues such as this one. And listen, I guess it depends on who's calling as to whether or not it's a health risk, you know. I'm not going to give any initials on the air, but no, seriously. There's actually an interesting study about all of this. And let's start with the basics. I mean, do these things pose a health risk to us by us using them a lot?
Well, there's been a lot of people who have postulated that cell phones might cause a health risk. And there was a study came out last week from France where French researchers looked at the connection between cell phone use and brain tumors. And what they did was they looked at the tumor registry to identify those patients with brain tumors that some people have postulated might be related to cell phone use. Specifically, they looked at the tumors meningioma and glioma. Most of these are benign tumors, meningiomas. Some gliomas can be malignant, but they're the more common tumors of the brain. And they also looked at healthy individuals and tried to kind of match them. And they asked these people, both groups, to recall their cell phone habits for the past 10 years. And they took that data and they analyzed that data.
Okay, so then how many hours were they on the phone? What type of cell phones did they use? I mean, was it for work? And then how ultimately is it that these cell phones can potentially cause cancer? I mean,
well, what they found was that they asked people how much they use the phone, and what they found was that people that didn't use the phone at all, compared to those that used it semi-regularly, at least once a week, had the same risk of brain tumors.
Okay.
But those that used it a lot, and those people that used the cell phones, what they call it a lot, had a slightly increased incidence of brain tumors. Now, let me say, this was the first or one of the only studies that has shown this, and so it hasn't been replicated anywhere else. There's some people that question the results of the study because the truth is, how do you remember how much you were on the phone 8 or 9 years ago?
In a quantitative way. I mean, I can say I was on it a lot, but I can't tell you like how many times during the day, the duration of my calls, you know, so
right,
what is the amount of a lot?
So if I ask you, Casey, how often you ate broccoli 8 years ago, you'd have a hard time remembering that.
Well, no, that's easy.
So
no, never.
But a lot was people that had more than 800 hours, they had 2 times the risk of brain tumors than those that had less than 800 hours of use in a given year. But people don't remember well. There's lots of limitations. The accuracy of how much they remember, how long they were on the phone 8 years ago is very difficult. The bottom line, I think, is that if we look at, since the introduction of cell phones, which really came into play in the early 90s,
Sure.
A lot of people said, we haven't seen in America an increased incidence of brain tumors. It's the same number of brain tumors. So
okay.
we would think if there's really a connection between cell phone use and the evolution of cell phones, we would see some change, but we haven't. But with any new technology, we should be aware of the potential effects on our body and find ways to minimize exposure. There could be some potential effects. We want to find ways to minimize exposure.
Well, real quick, and I'm looking at the video, and we were seeing people holding the phones up to their ears, you know, and sometimes you see those people with the Bluetooth in. And so I've heard some people say, and I don't know whether this is true or not, just hold it away, you know, put it on speakerphone, and it's better. I don't know, I'm, you know, kind of throwing that curveball. I don't know if that makes a difference or not.
Well, I think it does. When I talk to my patients about cell phone use and the potential health risks, it's not just brain tumors, but some have postulated about other health risks as well. I talk to them about 5 different points that I recommend. One is to put your phone on speakerphone and hold it away from you. That way you get less of the electromagnetic rays.
Okay, that's easy.
Right, so, or use a headset, like this headset right over here.
But what about the Bluetooth?
Bluetooth, I brought one today too, Bluetooth or a headset.
Fine.
Probably headset's better than Bluetooth, but either one, the electromagnetic signals come out of the phone, not so much out of the Bluetooth.
Okay.
So that's really more of the issue as the phone. Also, if you have a weak signal, you know, 1 bar, not 5, this is going to produce a lot more electromagnetic waves than trying to get connected to the cell towers. It puts out a lot more power, and it gets hotter more quickly.
Does. Okay.
And speaking of getting hotter, don't store it in your pocket. And don't store it, you know, in your men, you know, put it in their pants pocket. I know some women that kind of stick it right up here, you know, and they have it right there when they're in the car.
Yeah,
So
I
you
do.
don't-
And I do that. I'm one of those people because sometimes I want to listen, you know, to a podcast or something. So I'll put it right here on my shoulder because that way I can hear the speaker close to my ear. And now obviously I won't be doing that anymore. So
And also,
that one.
also, if you text instead of making a phone call, it's farther away from you. Not while driving, of course. but
Right.
That sort of thing.
So listen, I mean, at the end of the day, I mean, we had this one study that had this one result. You know, so nothing definitive, but is it just better because they are relatively new in the grand scheme of things? You said the early 90s. I mean, that is relatively new for them to be around. Is it better to be safer than sorry as far as your usage?
I think prudency with any new technology is always a good thing. So I think, yes, I think it's better to be safe than sorry.
All right, Dr. Ackerman, thank you so much, sir, as
Thank you,
always, for
Casey.
coming on. We appreciate it. And we're so glad that no one called you during that segment. Then your telephone number would be a direct line to Dr. Ackerman. We usually give you his Facebook page, but we thought we'd just give you your cell phone number if someone would call.
Okay.
And thanks to Dr. Ackerman, of course, for coming on every Friday and sponsoring this segment. And a special programming note, Dr. Ackerman normally joins us on Fridays, but he will be joining us next Tuesday, so you don't want to miss that for a special edition of Dr. Ackerman. And if you have any health topic questions, you can visit his Facebook page, which is facebook.com/First Coast Oncology.